We learn a lot about behavioral issues from a researcher, Dr. Karen Bonnick. Dr. Karen Bonnick did research to show that there was a correlation between sleep disorder breathing and behavioral issues in children the next day. And what we mean by sleep disorder breathing is really anything other than silent and invisible nose breathing. So the parent who recognizes that their child is sleeping and their mouth is closed and they're breathing through their nose and that breathing is silent and invisible, that would be a really good form of breathing for getting an excellent quality night's sleep. That pathway leads to refreshing, rejuvenated sleep that the child would wake up, ready to tackle the next day in a format where their behavior would be excellent and they would be attentive to all the details they needed to do at school. But the child who mouth breathes or worse, because the sleep disorder breathing category basically is everything other than silent, invisible nasal breathing. So when you are mouth breathing or worse, which could be snoring or even apnea type episodes, mouth breathing or worse, that disrupts the quality of the sleep. So with mouth breathing going on or worse, that child has a disrupted quality of sleep. And in the fancy words, we say sleep fragmentation. But for lay terms, we think about sleep deprivation. And so mouth breathing or worse disrupts the sleeping pattern, which disrupts that restful, rejuvenated technique that should be happening to set you for the next day. So basically, you wake up, even if you slept the right number of hours, it's not a quality night's sleep thanks to the breathing. But now without that good quality sleep, it's as if you were sleep deprived, and waking up sleep deprived does have a relationship to your behavior the next day. Dr. Karen Bonnick showed that the children who have sleep disorder breathing were 50% more likely to be diagnosed with ADHD.